The life of an 8-year-old girl is under threat, and doctors are intervening with the speed of light to save her. It has to do with her liver, and doctors at the surgical ward of the Kolebu Teaching Hospital are deploring all the knowledge and skills they have acquired to prevent the liver from failing. Dr. Asari Ofer, liver and pancreatic surgeon, is leading the about 14-member surgical team.
This is an abnormal swelling or tumor in the right lobe of the liver. So you can see that on this side looks a bit different from this side. So this is how the normal liver looks like. The color, the texture is slightly different from the abnormal side, which is tumor. So it means that the plan is to take all the abnormal side, which looks the bigger side, off, and then the child now will survive with a smaller side. Yeah, so the principle is that because the liver regenerates within about 4 months, we expect that this normal side will grow bigger to compensate for the function that we have lost here.
It is a difficult and complicated surgery, and because it involves the liver, it is even more delicate, as nothing should obstruct any of the functions it performs, as explained by Dr. Comfort Danso of the Tamale Teaching Hospital Internal Medicine Unit.
It produces carbohydrates, protein, clotting factors, takes the things that we take in, it helps in detoxifying some of them, bring it out. And then so many other little things, micronutrients, amino acids that the body uses for other things that the cells need. It does the production of those.
Back at the Kolebu Teaching Hospital, the surgical team is patiently cutting nerves and tissues attached to the swollen liver to detach it from the normal one. And because a child is involved, they need to be extra careful.
Children are different from adults in terms that their smaller size, their blood pressure, how their organs work is very, very different. And then, in adults have a much larger blood volume than children. So if a child just loses a small amount of blood, it's very significant.
The bigger side of the liver is the tumor. So about 1/3 of the liver now is what we are going to leave behind.
After close to 7 hours, the tumor has been completely removed. They have been able to save her life because she reported early.
The possibility of going into liver failure because of the tumor is out. So we're going to make sure after surgery, the small one that is left will be supported until it regenerates and grows bigger for her full size and weight.
Nobody can function well without a well-functioning liver. It needs to be healthy to make you healthy.
If the liver is sick, it cannot produce something we call albumin. And when the albumin is down, your system cannot produce things that fight against the infections. So that means anything can get you. When your liver is down, the brain uses a lot of glucose. It produces most of the glucose. So when it's down, your brain will be having a problem. When it can't detoxify some of the things we eat, that means it shifted to the kidney. So the liver have a problem and the kidney will have too much work to do. The kidney will be shutting down.
Congenital liver defect is what triggered the tumor in the case of this 8-year-old girl and nearly killed her. There are, however, many other diseases damaging livers and snuffing the lives of its victims.
Hepatitis B is the most important cause of liver cancer in Ghana. Then it means that liver cancer is also a burden.
Currently, there is no condition that you can actually really say that 1 in 10 Ghanaians are actually suffering from. So this is why I think it's important that we need to talk about this.
Globally, more than 50 million people die from hepatitis B-related conditions every year. This is out of the about 2 billion people worldwide who get exposed to the deadly disease.
If you look at all the studies, there's one study that recently tried to pull all this together to find an average, and it actually quoted 12.3%. So if you even want to make it simple for communication purposes, what it means is that 1 in 10 Ghanaians actually have chronic hepatitis B infection, which is really worrying.
The burden of the disease is high.
I was looking at data in 2019, and of our inpatients, 15.5% of the patients had liver cancer.
This is from the Konfonochi Teaching Hospital. It is not different in Ghana's premier hospital, the Kolebu Teaching Hospital. Dr. Asari is a liver and pancreatic surgeon at Kolebu.
If you come to the clinic in Kolebu, about 10 patients are seen every week with liver cancer. So that is quite an alarming number. And out of these 10 patients, you may just have one or even none who has cancer at a stage that can be treated. The majority of them are so advanced you cannot treat.
A recent study into national hepatitis B prevalence revealed about 4 million Ghanaians have the disease. This is really a public health emergency.
Chronic hepatitis B is a public health emergency, especially its association with liver cancer, and then we fight it.
Its mode of transmission is not different from the deadly HIV/AIDS. No wonder hepatitis B is equally deadly.
You can get it through blood transfusion, or you can get it through needle stick injection. And then tattooing. Tattooing too is a risk factor for hepatitis B because they do it, they don't sterilize it, they use it on another person.
Aflatoxin is a chemical that we get from molds, the fungus. And the fungus, you see them on cereals, grains, that you have stored them improperly. I mean, in a place where it starts growing, not in the fridge, but it's a place, humid area, and then the fungus grows on it. So some of the toxins secreted by the fungus is called the aflatoxin. So there are so many of them, but the aflatoxin that is called B1 is the one that can cause liver cancer. So if you have fungus or molds on your food, kenke, bread, maize, all those things that when you store them, we don't store them properly, they can develop molds. Fungus can develop on it.
Majority of cases, the transmission is from mother to child. That's about 85%.
Alcohol and chronic hepatitis B. These are the two topmost causes of liver cancer in our environment.
Hepatitis B is one of the few diseases doctors are gravely worried about, as explained by Dr. Asari.
Hepatitis B, you say you cannot cure it. So that makes it very dangerous when you're infected with it. And then aside not you being able to cure it, some people will live with it without having any complications. And some other people will also get complications from the infection. And this complication include cancer. Your liver becomes scarred and fails because cirrhosis.
The perpetual psychological, emotional, mental, and physical toll this deadly disease brings can forever change the lives of families. Theobald Owusu and says family can relate. How hard this hit them was the reason he swiftly set up the Hepatitis Foundation of Ghana to raise awareness about the disease.
In 2007, I lost some family members, and the sign, or let me say the symptoms of their condition was the same. So after they died, I asked my father what kills them, and he told me that it's a disease called hepatitis. And that time was my first time, that's 2008, I heard about hepatitis.
And how the disease can deteriorate and dehumanize its victims is the reason many perceive it as a curse and not a medical condition. Theobald says they also had this belief.
The yellowish of their eyes, and also their swallow of the legs, and their stomach was also big. And when they talk, you can see some bad odor from their. So this was the symptoms. First, we thought that it was a curse. Somebody has cursed the family and they are dying. But later on, we found out that no, it's not a case, but it was a hepatitis B.
So, one after the other, they died. Kwame Yeboah can also relate. His 41-year-old elder brother died recently from hepatitis B.
I've learned a bit about the disease, and I know it attacks the liver. And then the liver also plays a very important role in the human system. So when I heard that, I wasn't okay. But I just prayed that God should handle the rest.
Some of his organs had started failing by the time he was diagnosed. This became so conspicuous as Kwame Yeboah narrates.
He can't eat well. He can't sleep, especially in the night. And the palm and then the feet, it has started becoming yellow. And the legs, they have also started becoming swelling. Not talking about the belly.
These are not good signs as explained by Professor Uku and Dr. Asari Ofer.
One of the key functions of the liver is production of a protein we call albumin. And this albumin help at the tissue level to maintain fluid balance. And that is why you don't see your legs swollen or your tummy swollen. And so with the liver cirrhosis, where it's not performing that function of it, then an individual gets leg swollen, tummy swollen, the whole body swollen.
So once you have swollen belly, your feet is swollen, you have yellow eyes, you cannot eat, it's an advanced stage. And that's signs that your liver is failing. So you have signs of liver failure now. If you have signs of liver failure, it means one, you will not be fit for any form of treatment. So you only have palliation.
At this point, the liver has graduated to liver cancer.
When you have the viruses sitting there, they cause infection. It will heal, cause infection, heal, cause infection, heal. It will cause scarring. So when that keeps on going on, the regeneration process is being controlled. But at a point in time, it gives up. Because the thing is continuous. New cells are being produced. There's a lot of control of stop. So you can't stop. So you produce new cells which have nowhere to go and they accumulate at a particular place, new cells. So the cancer develops.
The average age of patients who have hepatitis B or liver cancer in Ghana are in the 30s, between 37 and 45 years. Some are as young as between 28 and 35 years. So it tells you that if you have hepatitis B, you are born with it, and you are developing the cancer in the 20s, it means that the hepatitis B virus has taken over 20 years to destroy the liver or to change it into cancer. For those who acquire the hepatitis B infection, not from birth, but whilst they are young, at younger age, we think that because you got it in your between 10 years, less than 10 years old, then it has taken about 20 years to develop the cancer. And that's why you come in with the liver cancer when you are in the 30s. We're seeing that the progression to liver cancer takes over 15 to about 30 years, depending on the individual.
The swelling signs are clear indications death is beckoning, and the pain that heralds it cannot be controlled.
I shared from my last patient, he tells me this is the worst pain that he's ever gone through. Because what is happening is that there's a tumor or a mass in the liver, and this mass is expanding. Usually even with morphine, which is one of the very potent pain medications that are given to patients, they still have pain. And so, from my experience, I mean, patients that I've managed and seen around, I can see they go through emotional and physical pain, which is these two together. It's one of the greatest pain that any individual can actually go to. That emotional aspect of knowing that you are living in your family and very little can be done.
Back to Kwame. Within a month after his brother was diagnosed of hepatitis B, he died. Watching his brother struggle to death is one particular scene he simply cannot erase from his memory.
Where I was standing, I was able to see him because he was lying on bed 6, which was a bit closer to the door where I was standing. So I saw him breathing in and out slowly. And I saw my brother dying, like vividly. I saw him breathing in and out, and I saw him not breathing again.
Doctors who care for hepatitis B and liver cancer patients are able to predict how close they are to their grave. But it is not easy breaking this news to either the patient or their families.
It's difficult because you are being told that in the next 6 months you may not survive because of the stage of your disease. It's very difficult. And so usually we have a palliative care team who are trained not only as doctors but also as counselors and psychologists. So they have a better way of passing on information, letting the patient and family appreciate and take it. And they die early because they delay in seeking help.
They have very short time to live, and most people will live 3 to 6 months and they are no more. And those who come in very early, in fact, a lot can be done. I mean, they can even achieve cure. So the early disease, small size, and there are many interventions that are available.
If these patients had early diagnosis and early treatment, some of these deaths could have been prevented over the years. One of the world's pharmaceutical giants, Roche, has provided Ghana and many other countries the tools needed for diagnosis. Dr. Philip Anderson is the country manager for Roche Ghana.
We recently brought to market the medicines for the cancers, but then for the hepatitis B infection, it has been on the market for quite a while. It's been available in the country for quite a long time, and I'm sure some doctors would have used it, some patients would have benefited from it. Now, if we are talking about the diagnostics, I mean, that has been there for a long time. It has helped in the diagnosis and the viral load testing for hepatitis. We are expecting that through the provision of these tests and diagnostics, patients would be picked up early.
In the northern part of Ghana, the condition is very high.
And all those drinks which are in the fermented state, these are quite very good risk factors if you look at it, especially in the environment. I think this probably may account for the reason why we see a lot of liver cancer, probably in the northern part of the country. I haven't done any research to actually confirm that, but this is actually a postulate for a reason why we see quite a number of liver cancer in the northern part of the country.
At the Tamale Teaching Hospital, Dr. Comfort Danso confirms this. In fact, patients come in daily with this condition, and most of them at an advanced stage. She and her colleagues have a fair idea why it is high in the northern part of Ghana.
I was certain we have polygamous marriage. Okay, so if one gets it, and I have about 6 wives, all of them are going to get it. So, and if 6 wives, they give birth and then they all have it and they don't have money to get that immunoglobulin, the children are going to get it. And then let's just say that our other causes whereby it's congenital and somebody didn't know, you are just going to give it to other people, especially if you are closely related to people and you exchange a lot of things, blades and other things. You're just going to give it to them because you have it and you don't even know.
In one of the awards, I meet a 50-year-old security man, Atongma Nyoringia, who has just been diagnosed of hepatitis B, which has advanced. He started feeling unwell right after the 2020 Christmas. The difficulty in breathing even manifests when he is talking. Doctors have confirmed what is wrong with him, but he has no knowledge about hepatitis B. He is not well at all. The liver cancer has spread to his lungs. It has really advanced.
Most of the patient comes in from stage C and D. When you are A and B, we're able to offer some form of therapy. I mean, depending on the size of the tumor, depending on the location, and also the functional capacity of the patient. we'll be able to either do excision, which we have a surgeon in the country who can do that, provided the tumor is at the right place, the right size. That is A. And B, we're able to offer some procedures to slow down the tumor.
It is a condition that brings untold financial burden on its victims and their carers.
There was a time the money got finished. So I started calling some of the relatives, some of the family members for support. And they also supported. And still, he couldn't. Sometimes I can buy a medicine for about 500 Ghana cedis.
And the reason why people doesn't go for the test is, if I don't know that I'm Hep B positive in school, if I know that I'm positive, it's going to bring economic burden on me. So I don't have to go and do the test. So sometimes if you want to even test 1,000 people, it's not easy to get them to test. It's free, but they will not come. They will tell you, if I test positive, I don't have money to treat it.
The huge financial burden is because the National Health Insurance Authority does not cover the disease, as explained by Dr. Bright Opon.
Most of the things we do for the patients are not covered under the insurance. Even with the private insurance, hepatitis B management, which is a major cause of the liver cancers, is an exclusion. Even with private insurance, the National Health Insurance doesn't cover most of the things. The CT scan, which is the standard for diagnosing, that's a triphasic CT scan, the standard for diagnosing the tumor. It's cash and carry. Bare pocket treatment, out-of-pocket treatment. And so as a stand, patient pay for everything, drugs and all that.
In the wards Dr. Micah and Dr. Opon work, there are patients there struggling to live and also struggling to earn a laboratory request and other medications doctors require for their next decision. Nancy Abua, though not her real name, is one, and she has been diagnosed of cancer of the cells of the liver, which is hepatoma, which is caused by hepatitis B. She is 26 years.
Patients like me need help because it's very, very, very painful. We go for labs, scans, it costs a lot. And being admitted here also costs a lot. So if the financial background is very, very poor, you're not going to make it. If you ask to go for a lab and you don't have money, how will the doctors will be able to take care of you? Everything involves money. So patients like me need help.
Under no circumstances must hepatitis B patients skip or stop taking their drugs they are on. It is a dangerous thing to do, as explained by Dr. Comfort Danso.
When you get this infection, you can't eliminate it. You can reduce the load. You can't eliminate it. And then when it's even left with a single virus and you don't continue taking your medication, it can give you problems. Unlike other viruses like C, you can take it off completely. But for B, when you even leave one day and the patient stop taking the medicine, it's going to give you a problem.
The deaths associated with liver cancer are high, as highlighted by Dr. Asari Ofer.
If you look at the liver cancer, at least from 2018 data of WHO, you will see that about 2,700 patients had liver cancer in that year. And then how many people died? Almost about 2,600 died. So it means that the liver cancer situation is so dangerous because the number of people who get the disease in a year, almost the same number die.
Mortality rate is very high. In 2019, among our inpatients, the mortality rate was 50%. 2020 is about the same, but because of the COVID, we didn't do statistics for that one.
With the awareness on the disease now, and with the proper diagnostic equipment and medication available, Dr. Philip Anderson is hopeful the narrative will soon change.
That is our expectation, and that is what we've set out to do. Typically when you roll out an intervention or a treatment and you sit back and wait to pick the patients only in the hospital, what you would realize is that many of the patients would report late. We don't expect much difference if we don't do anything differently this time. And that is why we are going out with the campaigns for people to test and know their status of whether they are Hep B positive or negative. If you are negative, would encourage and advise you to get vaccinated if you haven't as a child. And then if you are positive, you can immediately then begin testing for the markers that detect for the cancers. And then if you are picked early, then you will be treated. So that is why we are rolling it out in that manner. With that, we would see success.
Early screening for early detection is what doctors are pushing for to stop these preventable deaths which do burden the Ghanaian economy and families.
What I think we should do is that we should encourage people to come out. There's a need to share information and let people know that this is actually available. Number two is that once we have studied, and like I said, from my study, 75% of patients who have liver cancer actually have chronic hepatitis B. What it means is that we need to focus on chronic hepatitis B, do national screening. Those who are positive should be put in a treatment protocol. They should be in surveillance so that even if cancer will develop, you detect it early and do something about it.
You can prevent or you can treat if you see early cervical cancers, hepatocellular carcinomas, breast cancer, and many others, almost all of them. Once you pick them early, the outcomes are a lot more positive.
There is so much hope. I must tell you, from 2002 upwards up till now, the hepatitis B, the normal vaccination that we give to children, infants, has included hepatitis B vaccine. So instead of the DPT we were using, now we are using the pentavaccine, that's the 5. So hepatitis B vaccine is in there. So from all those, from 2002, 2003 upwards, have some form of protection. Those of us before 2002 had a small group of people that we think that active vaccination, active education, and then active testing can really help select this group of people. Because if that is not done, then they are now going to pass on to the next generation. So we can actually break this cycle if active testing and active treatment is done.